Right, welcome to the Brio Digital Tech for Good podcast. This is the 5th podcast, and I'm delighted to be joined by Phil Bottomley today. How are you doing, Phil?
I'm good, thank you.
Good. Phil works for Avenue3. Phil has an extensive background in health tech and technology, so really delighted that Phil's decided to join us today. So Phil, if do you want to kick us off and just give us a bit of a background to you and your extensive career and what you've been working on over the years?
Yeah, sure. I'd probably categorise my career as just building things. I've just always I've always built things from when I was very young. I used to be obsessed with Lego or Duplo or train tracks or just building toys. And throughout my career, I have built things. I started off as a junior software engineer, fresh out of university, and worked my way up the ranking.
What made you go into engineering in the first place, Phil? Were you doing it always, or was it just straight out of university thought I could probably take this on?
I was always interested in computers from a younger age. They weren't as fancy or as mobile as the computers that we have today, but I was always interested in computers.
Why does ZX Spectrum? Do you go that far back, Phil?
Yeah, I had Amstrad, Spectrums, all of the old school ones. So I was always fascinated with computers as a child, but I never quite joined my building passion for my computer passion until I kind of entered university and then discovered that I was actually really good at putting both of those two things together, and hence that turned into software engineering.
Right, okay. So where did you start out your career as a junior engineer?
So I started off at a very small digital agency, so building very simple websites and building modelling tools, so mainly sort of front end type applications. Right. And then I moved up the sort of complexity scale really into building more complex systems for different agencies and building more enterprise systems. And then I moved up further then into architecting systems rather than building them. And then I moved in from...
You've rapidly gone through all that. And what do you think made you progress? It seems quite quickly through your career. And what advice would you give to junior developers that are starting out?
I think it would be, you have to focus on probably 3 areas when you're a software engineer. One of them is you have to be very proud in your work. So quality is really important in building something that's got good foundations and works, first or second time is probably good advice. But the second thing I think is as well, everything's about delivery. Like, it's all about delivery. So having excellence and being excellent at building software is useless and is wasteful until it's actually delivered into the hands of the user. So that'd be my second part, is don't be too quality focused, but don't be too delivery focused. There's a happy balance between those two.
Right.
And the third thing I'd probably say from a software engineering point is building relationships with people that are not software engineers. So working with a client, understanding other people's points of view, understanding what the client wants to get out of it. It's not a technical project. Software engineering is not a technical skill. It's actually a technical skill combined with being able to speak to other people and the users and
that
customers.
Might scare a lot of engineers though, Phil, especially some that I've met over the years. But it's soft skills, it's a really, really important part of engineering. Is that why you feel as though you maybe progressed quite quickly in your career?
Yeah, I think you've got to have both. I think you don't need to. You need to be T-shaped, so there will be certain developers that are very good at the soft skills, which but are okay at the technical skills, and that's fine.
There's a place for them all.
There's a place for everybody. You've just got to be I think as a software engineer, you've just got to be well-rounded. You've got to be well-rounded, and you've got to be good at everything, but excellent at certain things. You don't have to be excellent at everything. You just have to be good at everything and excellent at certain things.
Okay. And then you've worked for consultancies, haven't you, in the past, Phil? Do you feel as though that gave you more broader domain knowledge across a variety of domains? It looks like you kind of settled into healthcare as well. Was there a reason behind that?
Yeah. I think consultancies give a really good variety. Yeah. So the good thing about my career is I've worked on lots of different challenges and different clients in different areas. I think I focused on healthcare because I was just always drawn to healthcare, because healthcare is a very complex area and it's a very challenging area, which is some of the downsides, but some of the upsides are if you solve those challenges and if you can digest that complexity, then it's hugely rewarding, because obviously the end customer is patients and
the outcomes are probably the best outcomes you can get in tech.
That you possibly could get. Yeah. So I think I managed to become a specialist in healthcare by having that variety, but also then discovering what I liked. And I was drawn, I liked and enjoyed and was good at.
Right.
So that's how I ended up in healthcare, because of that variety that I gained. But then I was drawn into, that's where I sort of learned.
Because of the complexity of health. Health tech in the UK, it's obviously huge, massive and very complex. It feels like your soft skills probably got you further in your career because of that, because you're having to deal with different consultancies. Yeah.
And translating very complex problems very simply.
Yeah.
I think a lot of that goes on in healthcare. Healthcare is extremely complex, but to get your to make your customers happy and to move your projects forward, you have to be able to translate that complexity in a very simple way, because not everybody is complex. And the big decision makers aren't as close to the detail. So it's articulating that detail in a simple way. I think that's
okay. So Phil, you now run your own company, Avenue3 health tech business that's based in Leeds. When did you set it up, Phil?
So we're a reasonably new company. So we are in our first year of. You're
brave in this climate, Phil.
We're very brave.
Foolhardy.
I think we're in our first year. I think I have a lot of good mentors, and one of my mentors said, sort of articulated this very well about startups. There's never good time to set up a startup. There is only imperfect timing. Is the way they phrased it. So when you put it in that mindset, if an opportunity arises and you feel like you've got enough momentum to take the leap, I think you should take the leap. And we took that leap, and we're in that whirlwind.
Well, with kindred spirits, I set up during lockdown.
There you go.
So I left a very good desk to go back down to zero and start in lockdown. So that was a leap. And then some. But it's going well. So how's it gone then in the last year, Phil, for Avenue3?
Yeah, really, really well. I think there's certain things you expect. There's certain things you don't expect.
So what are those things that you don't expect?
I think some of the things that I didn't expect is, more on the positive side, is how many, I think because I'd worked in consulting for a very long time, you don't really, because you're so focused on delivering for your clients, and you can become quite tunnel visioned. And actually, I think I hadn't really popped my head. I've been working really hard the 2 years prior. I hadn't really popped my head up and sort of seen what was out there. And obviously, when you launch your own business, you are putting yourself out there quite strongly, as you know. As you know, did it yourself. So I think one of the things I didn't expect is how many people would just get in touch with us and other small businesses, not necessarily competitors, some non-competitors, just people trying to help, people offering help. And I think that's been really positive for me, really.
Well, I think the consultancy market and the tech consultancy market in Leeds is really buoyant. And I think that a lot of people do share knowledge, often sales as well, to help out. So I think it's a great place to set up, I think. So how many staff have you got now, Phil, as a business?
So we're up to eight staff.
That's really good going
in the first year. So we've gone up to 8. I think we've met all our year one objectives in terms of our growth plan in that first year. So we're just entering into our second year now and deciding what we're going to do next, whether we're going to hire some more staff and what objectives we're going to lay out in front of us. So we're really happy with the way the first year one has gone. It's been great.
How do you convince people to join what could be seen as a risky startup in a risky market? Well, health tech isn't risky, but a risky time. How do you convince people? How do you share your vision?
Well, I'm going to let you in a little bit to our secret interviewing source here, but it's not that.
Well, go for it.
It's not. The answer isn't that secret. I think being open with people and transparent about everything in the interview process is the most important thing. So every member of staff that we have employed, we have been open and honest about the benefits of joining Avenue3 and the risks of joining Avenue3. So I think, and every single person that signed up into our business was articulated the same message. Here's the good things, here's the bad things. It's not for everybody. That's fine. If that's not for you, that's absolutely fine. So that has been our approach all the way through, and that's really paid off.
Do you feel like with it being health tech in the developer community, that's gone down really well, as opposed to maybe a retailer or a bank? Not that there's anything wrong with those industries, but do you feel as though that ethos has attracted more people quicker than maybe other areas?
Absolutely. I think one of our other core values at Avenue3 is everybody needs a purpose. And I think that tech for good, health tech space gives that gives that purpose. So I think that is something that we're really passionate about, is what is, even for every client that we work with, we really reflect on ourselves, or if we're about to work with a new client, it's like, what is the, what is the long-term social value, purpose for what we're doing? And if it doesn't meet, if we don't think there is any, what's the purpose that our employees and us and everybody are going to get out, our teams are going to get out of this? I think that is a massive benefit to working in this sector.
Okay, well, what's your USP to customers and clients as a health tech business? It's a really busy market. We've obviously, that all the top 4 are operating in this market, some global system integrators. What's your ethos? Why are you a bit different to some of the other consultancies out there?
So one of our very highly expert specialties is we're really good at designing what are called open data architectures. Which
we're going to talk about this as well, weren't we? In terms of the open data, you're the chair. You're a chairman or a co-chair for the standard.
There's a new movement starting in healthcare, and this is the open data movement, and that is all about how we design our systems in healthcare. And the reason healthcare has picked up on this is because healthcare data. If you think about healthcare data, it needs to be stored for almost 100 years. If you just take that, we need to store Rob Foley's personal data for 100 years. But actually, IT systems don't last 100 years. IT systems are replaced on average about every 20 years. So actually, when the healthcare industry, not just in the NHS, but internationally as well, in Europe and starting in America, have sort of come to this conclusion that designing systems whereby the data is more portable in that migration or is separated from the actual applications that we build is the way that we should architect systems. And that we've become very expert in that for the clients that we work with, and we do a lot of architecture work. I
was going to say, is it a way you set up these systems from an architectural point of view? So I've heard of FHIR and HL7, which are they separate? Are they kind of the messaging standards?
So they're messaging standards. They complement the OpenAIR standard, but OpenAIR is a standard of how we store data, not how we transfer it. So it's more about how we store it on the hard drive rather than how we post it through the postman. So they're very complementing. Like, they will both be required in the future. But it's really a new way to build systems, not a new way to send data.
So where did this movement come out from?
It's been going around for a very, very, very long time.
Has it?
Yeah, it's been around for quite a few decades. But I think
is it gaining more traction now?
It's gaining more traction now. And some other wise person once said to me that if you plot kind of the great innovations in history, they actually have been invented almost 20 to 30 years before they actually then take off and become marketable. So people talk about tablets. Tablets were invented way before. Tablets have been around for ages, but they had just reached a momentum and a maturity where then they could be launched and become mainstream. I think with open data and OpenAIR, we're moving to that as well. So it's about 20 years old, but now people are now realizing that the systems of today are not going to be fit for purpose in a decade's time. So it's really, the momentum's definitely.
And does this save money then for the government and the public sector? Is it stored in a way where they're not having to reinvent the wheel every 20 years to keep the data? Is that how it works?
I think it will make things cheaper in the long run. I think the big benefit to the NHS is it means that when that data does need to be transferred, it can be transferred a lot easier. And I think the NHS struggles with joining up data between different hospitals and different agencies within the NHS. So that's the real benefit to you as a patient, is that you will, in the future, it's not going to happen tomorrow, it's a long-term movement. It's a bit like climate change. Can't be solved today, but can be solved in 20 years. It is laying the seeds to mean that we can transfer data between NHS organisations more easily, and also utilise more advanced technologies like AI. So AI is very good, but AI is only as good as the data that can go into it. So it's all about making that data quality.
Is it making it more open source then in a way? Or is it all to do with interoperability of the different points of healthcare, from like GPs to urgent care?
So I think definitely that definitely makes it easy to transfer. I think in terms of the transparency and the ethics, the good thing about having open data is that you can you model the data and then you can share that publicly. Whereas if you have a closed system, there's a lot of commercial sensitivity around that closed system. So those suppliers don't necessarily want to share their data model. But whereas when you just take that out of the equation, and suppliers can still compete on the functionality, but they're not competing on the data, the ethics become a lot more relaxed, and the ethics around. I think there's a big public mood starting around the worries about AI, and I think open data has a part to play in soothing those worries with the public, because with open data you can be transparent with the public about what you're storing. If you architect systems in a more transparent way, then you can be transparent with the public about what you're storing. I think a lot of the worries that the public have around data is they don't know even what's being stored. That's the first barrier. Before you even get to what supplier is, what the project is, what the government initiative is, there's no transparency on what's actually being stored. So open data helps alleviate that. In just that first initial problem is what is stored about me.
And are you implementing these architectures at the moment into various trusts and NHS environments? How's that going?
Yeah, really well. Yeah. So because it's been interesting to see in which areas of the NHS in England and in which areas internationally are picking it up. And I think people predicted that actually the lower maturity trusts would pick it up first, but actually it's been the opposite. The highest maturity trusts have picked it up first. Yeah. So that's really interesting. Yeah. So we've got we're working with several clients in the NHS around architecting open data in the first instance, because that's usually the beginning of the journey. But we're also working with customers where we're building those architectures for them as well, because we also have expertise in not just the designing, but also then implementing as well.
Right, okay, no, brilliant. Something we spoke about before, you're doing some amazing work with Christie's Cancer Hospital at the moment. Yeah. You've been working there fairly long term. How's that going with the trust? Yeah. What have you been working on? I imagine some amazing outcomes and deliverables that you've had with them.
Absolutely, yeah. So the work we're working on with the Christie is we are building a patient engagement portal for them. Cool. So if you're a patient at the Christie and you have treatment at the Christie, and throughout that treatment, because Christie is very long-term treatment because it's cancer, or cancer is a very long disease. So throughout that period, you'll have treatment at the Christie, and the good thing about the work we're doing is we're building a patient engagement platform for the Christie, which means that the patient throughout that treatment, when they're at home, can see where their treatment's up to, they can contribute to their record, they can see when the next appointment is, they can get notifications about their treatment. It takes
the stress out of obviously a horrible situation then, doesn't it?
Absolutely, yeah. So communication is the key, and communication is the key to reducing stress, always. Yeah. So that's a really fulfilling project that we're working on for the Christie. Okay, great. And what are your plans for the future with Avenue3, Phil, when we're looking to next year? Yeah, so we're just keen to keep doing what we're doing, delivering for our clients, but also one of our principles is also to be innovative and imaginative and be a bit disruptive. So we're just really keen to work and design and build in this space to tackle some of those. Are you going to be building your own products in the future, do you think, or are you going to be more bespoke to the customer? No, we haven't got a plan to build any products just yet. It's not something we've excluded necessarily, but we're our bread and butter is consultancy and delivering outcomes for clients. Brilliant. Right, Phil, I think that's been a great overview. No, thanks so much. I think that's been really, really interesting. Thanks a lot. Thank you. So brilliant. Thanks a lot for listening, everyone. There's going to be more podcasts coming out, so do hit like and subscribe from wherever you get your podcasts. Thanks a lot.